Social media, Facebook, Google, other ways of communicating through social media are anonymous. And so this affords a significant level of protection for MSM. They have nothing to worry about when they're reaching out or communicating with somebody on the internet or through their mobile phones. My name's Kimberly Green. I've worked with FHI 360 since 2004, first in Vietnam as a regional technical advisor for Asia and the Pacific, and now I'm the Deputy Country Director for FHI in Ghana. For MSM in Ghana, the sociocultural and religious environment for MSM is it's quite a hostile one. It's very difficult to be open about who you are. And therefore, even though we've done a lot of work to try to make sure that peer educators are on the ground reaching out to MSM, there are the drop-in centers, there's still a need to be able to reach or connect with MSM through an utterly anonymous platform. And the perfect platform for that is through mobile phones, both through texting and also through social media. We started initially with something that's called the Text Me, Flash Me, Call Me helpline. And what this is that in Ghana you can flash someone. And what flashing is that you can call, you can hang up, it's free, and the person who's received your call can call you back. And so we have created a system through an SMS aggregator, through a local company that has basically linked together a group of counselors who can then be called upon by MSM and by other key populations. They flash or they text a message, and then they get a call back from the nurse. When this program first started, we asked MSM, who would you want to talk to? Do you want to talk to a peer educator? Would you like to talk to an NGO worker? Who? And they said, we want to talk to the nurses. They understand us, they know how to help us. There are usually 3 nurses who are on at any one time, so that whoever it is who flashes or calls or texts, they will get a response back. For MSM who are part of the program already, they're already being reached by a peer educator, they're offered the option of receiving a weekly text message. They felt it was important to get those reminders about don't forget your condoms, don't forget your lubricants, have a great time, but make sure you bring those with you. Through peer education, through the drop-in centers, we are, as I mentioned, reaching about 19,000 MSM. Most of the individuals that we reach are young. They're under the age of 35. Most of them are more effeminate and maybe more open about who they are. We recognize that this is a proportion of total MSM in Ghana, and there are many others, those who are older, those who are more discreet about who they are, those who are more masculine in their identification, and we're not reaching them currently through our peer education efforts or drop-in center. In order to be able to begin to tap into these populations so that we can link them with key services, we started working with MSM who represent those networks, who were interested in working with us. They operate as community liaisons, and they use social media. They basically they set up Facebook sites, they use a site that's called WhatsApp, they use gaydar, they use all sorts of different means of reaching their friends, which is how they had done it before, but now with a purpose in terms of linking them to key information and services. So we piloted this with one MSM liaison, and from January to March of this year, one individual was able to reach about 2,300 MSM. So just tapping into his network alone. And that resulted in providing information on condoms and lubricant, particularly where to get lubricant, which a number of the individuals he's in contact with weren't sure about, and also linking to access HIV testing and counseling and STI services. About 40% of those that he's reached are over the age of 35. So that gives us a sense that he's definitely reaching a population that we otherwise never would have through our current program structure. So that's been very important. So it's really those three. It's the helpline counseling, which is this more emergency or this immediate way of being able to contact somebody about health concerns. The second M health intervention are these routine behavioral reinforcement messages. And then the third is the social media and reaching out to populations we haven't reached before.